Governor Mike DeWine says now is the time to act to keep the curve down. He says now is the time to wear a mask.
My friends, this is not a drill. This certainly is not any hoax. Ohioans have always been a people who've been willing to sacrifice today for a better tomorrow.
The governor asking people wear masks whenever you step out in public, no matter where you live. He says even for those who doubt the validity of mask wearing, there's no question that it could help save lives.
The jury's back. The verdict is in. There is a broad consensus today in the medical, health, and business communities that masks are critical.
DeWine says that wearing masks for the next 4 to 6 weeks could ultimately drive the pandemic into the ground. And tonight, local healthcare leaders tell us they like what the governor had to say.
This is our chance to do things right again. He didn't require us, but really encourage all of us.
Maybe soon closing.
Well, they are responding tonight after Governor DeWine set the tone during his formal statewide address.
The governor didn't issue a mandate or declare an order. He simply asked that Ohioans look out for each other by donning face coverings.
WCPO 9 News reporter Jake Rouse spoke with healthcare professionals here in the tri-state for their take on the governor's plea.
Well, Cincinnati Health Commissioner Melba Moore likened it to hitting the reset button, an opportunity for Ohioans to help flatten the curve once again by doing something as simple as putting on a mask. A call to action.
And that's exactly what the governor we thought was going to do and did.
Dr. Steve Fagans with Hamilton County Public Health.
A little inconvenience by wearing a mask can go a long way in preserving our ability to return to school, possibly play sports.
Dr. Jamel Bowers has been on the front line of the pandemic.
Surgeons wear their masks every day and nobody's falling over. Everyone's handling that just fine.
She's the regional medical director for Sound Physicians. They provide inpatient services to Mercy Health.
Right now we still have room. We are certainly getting more full than typically what we would see in the summer months, but we are certainly able to handle the capacity. But it is getting concerning if we were to continue to go in the wrong direction.
So what should you know before heading out the door? Leave the surgical masks for medical professionals.
We really do need them more as we really have known direct exposure to those patients. In the community, a cloth mask is just fine.
She says treatment has improved over the past few months, but that doesn't stop the snowball effect, longer stays in the hospital on top of more people coming in.
And then that's when people start to reach capacity, and we don't want to do that if we can avoid it.
The number of Ohio cases increases, but these healthcare workers say there's still time to slow the spread.
If we were to continue on this track, I think it might become more worrisome. I think right now we are still able to handle the capacity, but we don't want to get to a point where we cannot.
And health officials tell us if 80% of people wear masks while they're out in public, we could see a flattening of the curve within several weeks. Jake Ryle, WCPO 9 News.